Hello everyone, my name is Eli Beiler, and welcome back to the channel. If this is your first time here, I'm genuinely glad you found it. I'm 87 years old. I've lived my entire life in the Amish community of Lancaster County, Pennsylvania, and what I share on this channel comes from one place and one place only. The way my people have lived, worked, and cared for themselves across generations, not from a textbook, not from a clinic, not from anything I read on a screen, from 200 years of farming the same land, growing the same plants, and paying very close attention to what the earth provides and what the body responds to over a long and working life. People ask me sometimes how it is that men in our community are still doing real physical labor into their 70s and 80s, still lifting, still bending, still getting down on their knees in a field and getting back up again. And the answer is not one thing. It is never one thing. But the plants I'm going to describe to you today are a significant part of that answer. Today, I want to talk about something that I know is on a lot of people's minds, because I hear about it constantly, from neighbors, from people who write in, from people who grew up in communities like mine and moved away and are now dealing with something they never expected to deal with at 50 or 60 or 70 years old. I'm talking about knee pain and joint pain. The stiffness that greets you before you've even gotten out of bed, the ache that builds after sitting for an hour, the feeling that your body is working against you instead of with you, and the growing sense that the only choices available are pain medication with a side effect list longer than the bottle, or simply learning to live with it. I want to offer you a third option today, 7 of them in fact, and before I start, I want to say one thing plainly. Every plant I'm about to name grows within a mile of this farm. I have never taken an ibuprofen in my life, not once. I say that not to be boastful. I say it because I think it demonstrates something real about what these plants are capable of when you know how to use them, and when you've been using them consistently your whole life, rather than reaching for them in desperation. The first plant is one that most people have heard of, and a smaller number of people actually understand. Turmeric, the bright orange root that has been used across Asian and Ayurvedic traditions for thousands of years, and that has, in the last 2 decades, become the subject of more scientific research than almost any other plant in the world. My community has used it for as long as I can remember, though we came to it through a different path than Eastern traditions. Through trade, through contact with other communities, through the simple observation that when people used it regularly, their joints behaved differently as they aged. The active compound in turmeric that researchers focus on is called curcumin, and curcumin has been shown in multiple published studies to inhibit several of the molecular pathways involved in the inflammatory response, including the NF-κB pathway, which is one of the central regulators of chronic inflammation in the body, and the same pathway that many pharmaceutical anti-inflammatory drugs target. A 2016 review in the Journal of Medicinal Food analyzed 8 randomized controlled trials and found that curcumin supplementation significantly reduced joint pain and improved physical function in patients with osteoarthritis, with results in some trials comparable to ibuprofen. Now, I want to be straightforward about the one real limitation here because I think honesty serves you better than enthusiasm. Curcumin on its own is not easily absorbed by the body. It is fat-soluble, meaning it needs to be consumed alongside of fat to be properly utilized, and it is dramatically more bioavailable. Some studies estimate up to 20 times more when combined with piperine, the active compound in black pepper. My grandmother knew none of this by those names. What she knew was that turmeric went into food with butter, and that you ground the black pepper alongside it, because that was the way it had always been done. The science spent decades catching up to what the practice had already worked out through observation. That is a pattern you are going to encounter more than once today, and I think it says something important about what careful, generational attention to the body can accumulate before a laboratory ever points a camera at it. The second plant is one that most people in the modern world have never heard of, which I find genuinely puzzling given how effective it is. Comfrey. It grows in this valley in abundance, broad leaves, small purple flowers, a root that goes deep and dark into the earth. It has been used for centuries as a topical treatment for bruises, sprains, and joint pain, and the reason it works is something researchers have now been able to identify fairly precisely. Comfrey contains compounds called allantoin and rosmarinic acid. Allantoin accelerates cell regeneration and has anti-inflammatory properties. Rosmarinic acid is a potent antioxidant and anti-inflammatory in its own right. A randomized clinical trial published in Phytotherapy Research found that a comfrey root extract ointment applied to the knee outperformed a pharmaceutical diclofenac gel on several pain measures over the course of the study. I want to be very clear about one important thing, because I believe in giving you accurate information. Comfrey contains pyrrolizidine alkaloids, which are compounds that can cause liver damage if consumed internally in large amounts or over long periods. This is a plant for external use, as a poultice, as an ointment, applied to the skin over the affected joint. This is exactly how my family has always used it, and exactly how I would advise you to use it. The topical application does not carry the same risk as internal consumption, and the topical evidence is genuinely strong. The third one is willow bark, and this is the plant that will help you understand where aspirin actually came from, because that is the real story, and I think it is a story worth knowing in full. For most of recorded human history, people in pain chewed the bark of the white willow tree or brewed it into a tea. The ancient Egyptians used it. Hippocrates wrote about it in the 5th century B.C. Indigenous peoples of North America used it independently of everything happening in Europe. The active compound in willow bark is called salicin, which the body converts into salicylic acid, and salicylic acid is the direct chemical precursor to acetylsalicylic acid, which is what aspirin is. When the Beiler company synthesized aspirin in 1897 and began selling it to the world as a modern pharmaceutical breakthrough, they were not discovering something new. They were isolating, stabilizing, and patenting a compound that had been managing pain and inflammation inside the bark of a tree for thousands of years before a chemist was born. The difference between willow bark and aspirin is that willow bark contains salicin within a complex matrix of other botanical compounds, tannins, flavonoids, additional phenolic acids, that appear to work together, moderating the effect and significantly reducing the gastric irritation and stomach damage that aspirin is well known to cause with regular use. A Cochrane review found evidence that willow bark extract was more effective than placebo for lower back pain. Studies in osteoarthritis patients have shown meaningful reductions in pain scores over several weeks of use. My family has made willow bark tea for generations. A small handful of dried inner bark, steeped in boiling water for 10 to 15 minutes, covered to keep the volatile compounds from escaping with the steam, taken during periods of significant joint pain or inflammation. It is bitter. I am not going to pretend otherwise, but some things worth having are not sweet, and the bitterness is a small price for something that has been earning its place in this community for 200 years. The fourth plant is Boswellia, which comes from the resin of the Boswellia serrata tree, and which has been used in Ayurvedic medicine for joint pain for centuries. The active compounds in Boswellia are called boswellic acids, and they work through a mechanism that is somewhat different from the other plants I've described. They appear to specifically inhibit an enzyme called 5-lipoxygenase, which plays a key role in the production of leukotrienes, one of the primary drivers of inflammatory joint degradation. A randomized, double-blind, placebo-controlled trial published in Phytomedicine found that patients taking a standardized Boswellia extract reported significantly reduced pain and significantly improved function after 8 weeks, and the authors noted that improvements began to be reported as early as the first week. Another study found that Boswellia extract slowed the breakdown of cartilage in arthritic patients, which is a meaningful finding, not just pain relief, but potential structural protection. I want to name this one specifically for the people watching this who have been told that their cartilage is degraded and that there is nothing to be done about it except wait for a replacement. The research is not conclusive, and I am not a doctor, and I am not making medical promises. What I am saying is that the evidence is real, the mechanism is understood, and it deserves your attention. The fifth plant is one that not everyone will have heard of, and it comes from southern Africa, which means, unlike the others, it does not grow within a mile of this farm. I include it anyway, because the evidence for it is genuinely compelling, because my community began using it some years ago when it became more available through herbal suppliers, and because I believe in giving you the full picture rather than limiting myself only to what grows in Lancaster County. The world is larger than one valley, and so is 200 years of accumulated knowledge about what helps the body heal. Devil's claw. The name comes from the appearance of the fruit. Hooked, claw-shaped, unmistakable if you have ever held one in your hand. The root has been used by indigenous communities in the Kalahari region for generations to treat pain and inflammation, and it reached European herbal medicine in the early 20th century through researchers who noticed how consistently it was being used and what conditions it was being used to treat. The active compounds are iridoid glycosides, primarily one called harpagoside, and they appear to work through multiple anti-inflammatory pathways simultaneously. A systematic review published in the journal Rheumatology found that devil's claw extract was significantly more effective than placebo for osteoarthritis pain, particularly in the hip and knee, the joints under the most long-term mechanical load in a person who has spent decades working on their feet. The European Medicines Agency has classified it as a well-established herbal medicine for the relief of minor joint pain, and I take that classification seriously because it means a regulatory body reviewed the accumulated evidence and found it sufficient to make a formal recommendation. My caution with this plant, and I want to name this clearly, is that it can interact with blood-thinning medications and certain cardiac medications. If you are on any prescription medication, please speak with your doctor before adding devil's claw. That is good practice with all of what I describe on this channel, and I want to say it directly rather than assume you will infer it. The sixth plant is one that is already in most people's kitchens, and almost no one is using it this way. Ginger root. Fresh, dried, powdered. All of it carries the same core compounds. Gingerols in fresh ginger, shogols in the dried form, and both have been studied extensively. These compounds inhibit the same cyclooxygenase enzymes that ibuprofen inhibits, COX-1 and COX-2, which regulate the production of prostaglandins, molecules that drive pain signaling and swelling. A double-blind, placebo-controlled trial published in Arthritis and Rheumatism found that ginger extract significantly reduced knee pain on standing and after walking in patients with osteoarthritis of the knee. A separate trial found that highly purified ginger extract reduced pain and stiffness in osteoarthritis patients significantly more than placebo, with a safety profile that compared favorably to conventional non-steroidal anti-inflammatory drugs. What interests me about ginger, beyond any individual study, is the sheer consistency of its use across completely separate traditional cultures. Chinese, medicine, Ayurveda, European herbalism, West African traditional practice, the traditional medicine of the Pacific Islands, all arrived independently at the same root through completely different paths, none of them in communication with the others. When something is that consistent across cultures that had no contact with each other, I think it tells you something that a single clinical trial cannot, which is that generations of careful observers in different parts of the world all notice the same thing. We use ginger in this kitchen every single day, in food, in tea, as a warm compress applied directly to painful joints during the cold months when the stiffness is worst. It is not a dramatic rescue, but used daily and consistently over months and years rather than days and weeks, it does something real and cumulative. Most people are looking for the dramatic intervention, the one thing that will fix everything quickly. What actually works, in my experience, is the quiet, daily practice that most people don't have the patience to maintain. Ginger is that kind of medicine. It rewards the people who show up for it every morning. The seventh and last plant is one that requires the most care of anything on this list, and I want to explain exactly why before I tell you how it is used, because this one is powerful enough that getting it wrong matters. Arnica, a small yellow flower that grows in mountain meadows across Europe and parts of North America, and that has been used in European folk medicine for centuries for bruising, swelling, muscle soreness, and joint pain. Arnica is used topically, as a gel, as a diluted tincture, as an infused oil worked into the skin over the affected joint. It contains sesquiterpene lactones, primarily helonalin, that have demonstrated anti-inflammatory and analgesic properties in laboratory research and clinical studies. A 2007 randomized trial found that arnica gel was equivalent in effectiveness to ibuprofen gel for hand osteoarthritis over a 3-week period. Another study showed meaningful reduction in knee osteoarthritis pain with topical arnica application. The caution, and I want to say this as plainly as I can, is that arnica should never be taken internally and should not be applied to broken or open skin. Used correctly on intact skin, it is safe and effective. Taken internally, even in small amounts, it is toxic and the effects can be serious. My grandmother knew this without any study telling her. It was simply part of how this plant was understood and passed down in this community, what it was for, how it was used, and what the boundary was. That boundary was not written down anywhere. It was taught, person to person, generation to generation, the way all the most important things in this community are taught. And that transmission, that careful, verbal, generational passing of how to use the earth's medicine correctly, is, I think, one of the things we have lost most quietly in the modern world, and one of the things I most hope this channel can help restore in some small way. So that is the full list. Turmeric root for its curcumin, and what it does to the inflammatory pathways that drive joint degradation. Comfrey leaf, applied as a poultice for structural joint pain, where something deeper than surface soreness is happening. Willow bark steeped into a tea that has been treating inflammation since long before aspirin had a name or a patent. Boswellia resin for the specific enzyme pathway it inhibits, and the cartilage protection the research suggests it may offer. Devil's claw for its well-documented clinical evidence in hip and knee osteoarthritis. Ginger root used daily and consistently as the quiet foundation of an anti-inflammatory kitchen and a daily ritual, and arnica applied carefully to the skin for pain and swelling that you can feel from the outside. Not one of these plants requires a prescription. Not one of them carries the long-term risk profile that regular ibuprofen or naproxen use carries. The gastrointestinal damage, the kidney stress, the cardiovascular effects with prolonged use at high doses. I'm not telling you to throw away your medication. I'm not a doctor, and if you are being treated for a serious condition, please keep working with your doctor and bring these plants into the conversation rather than replacing that conversation. What I am telling you is that these plants have been managing joint pain in communities like mine for 200 years, that the science is increasingly confirming what that long history already established one generation at a time, and that this information is yours whether you decide to act on it or not. My grandfather never had a knee replacement. My father never had a knee replacement. I am 87 years old. I knelt down in the garden this morning to pull something up, and I stood back up without holding on to anything. I tell you that not to impress you. I tell you that because I want you to understand that what I'm describing is not theoretical. It is the life I have actually lived, and these are the plants that have been part of that life from the beginning. Share this with someone who is struggling quietly with this, and I will see you in the next one.